You know that feeling when it feels like your heart just skips a beat? That little flutter, maybe a pause, then a thump in your chest? Yeah, it can be really unsettling. And honestly, it's one of the most common reasons people come to us, worried about their heart. They almost always describe it just like that.
Well, what if I told you that in a lot of cases, that feeling is caused by something called a premature atrial contraction? We just call it a PAC for short. Today, that's exactly what we're going to do. We're going to demystify this whole skipped beat thing together. I'll be your guide, breaking down what's going on, why it's happening, and most importantly, what we can do about it. So, where should we start?
Well, the best place to start is to actually look at your heart's electrical activity. And to do that, we use something called an electrocardiogram, or an ECG. You know that strip of paper with all the squiggly lines? That thing tells the story of every single heartbeat, including those little flutters. So let's take a closer look and see what your ECG is telling us.
All right, so what exactly is a PAC? I know, the name sounds pretty technical, but the idea behind it is actually really simple. It's just an early heartbeat. See, your heart has its own natural pacemaker, called the SA node. Think of it like the conductor of a big orchestra. But every once in a while, a little spot in the atria, that's the heart's upper chambers, gets a bit irritable, a little too eager, and it fires off a signal a bit too early. The analogy here is perfect. It's like an eager musician in the orchestra playing their note just a little too soon. It just throws off the rhythm for a second.
And right here, you can actually see the effect of that eager musician on the ECG. So on the left, you've got a nice, normal, regular rhythm. But now look over on the right. See that? Look closely. You see that one P wave that pops in way too early and looks a little different from the others? That's our PAC. That's the little hiccup that's interrupting the heart's regular tempo.
Okay, so for anyone out there learning to read ECGs, this is absolutely crucial. You want to look for these key signs. First, the rhythm becomes irregular, but it's because of that one early beat. If you kind of cover up the PACs with your finger, you'll see the rhythm underneath is usually perfectly regular. The real star of the show here is that P wave. It's early and it looks different. Now, it's usually followed by a normal-looking QRS complex because the signal still makes it down to the ventricles. And then right after, there's often this little pause. That's just the heart's main conductor, the SA node, hitting the reset button on the rhythm.
Now, here's something interesting. Not every single PAC gives you that thump feeling. Sometimes that early signal from the atria, it just doesn't make it down to the ventricles. We call that a non-conducted PAC. And on the ECG, the difference is super simple to spot. A conducted PAC has a QRS complex right after that early P wave. But a non-conducted PAC, it's just that early P wave all by itself with no QRS following it. It's exactly like the analogy says. The eager musician played their note, but the rest of the orchestra just didn't hear it, so they didn't play along. Okay, so this brings us to what's probably the most important question, right? For patients and for us clinicians, what is making that spot in the atria so irritable to begin with? You know, what's actually triggering these early beats?
A really handy way to remember the common causes is this little mnemonic, atrial. So A stands for atrial enlargement, which is more of an underlying structural thing. But check out the rest of the list. T is for tobacco use. R is for regular stimulants, think caffeine. I is for inflammation. The other A is for abnormal electrolytes like low potassium or magnesium. And L, that's for lots of stress. Did you notice a theme there? So many of these are tied directly to our lifestyle.
And honestly, that is really good news, because it means that a lot of these triggers are things we actually have some control over. You know, that feeling of being totally swamped by a big project at work, or that extra shot of espresso you needed to power through the afternoon, even just being a little dehydrated, all of those things can make the heart just a bit more irritable and more likely to have these early beats. Of course, it's not always external. Sometimes the cause is internal, like a structural change in the heart, such as atrial enlargement. And that's exactly why if PACs start happening all the time, or if they start showing up in these distinct patterns, we're going to want to monitor things a lot more closely. We just need to make sure there isn't some other underlying issue that we need to deal with. And hey, speaking of patterns, that is the very next thing we look for on the ECG. Are these PACs just happening randomly here and there, or are they starting to show up in a predictable rhythm? Because the pattern, believe it or not, can give us a ton of clues about what might be going on. So one of the most common patterns is something called atrial bigeminy, and it's a really simple one-to-one pattern. You get a normal beat, then a PAC. Normal beat, PAC. It just keeps alternating like that over and over. It's a very consistent rhythm. And then you've got atrial trigeminy, and I bet you can guess this one. This is where every third beat is a PAC. So you'll see 2 normal beats, then a PAC. 2 normal beats, then a PAC. Seeing these kinds of patterns really helps us get a handle on just how frequent these PACs are.
Okay, so we've figured out what a PAC is, we've talked about what might be causing it, and we've even looked for patterns. The big question is, what do we do about it? Well, here's the best part. For most people who just have occasional PACs and aren't having any major symptoms, the management plan is actually pretty straightforward, and it puts you in the driver's seat.
So our plan is a pretty simple 3-step approach. Step 1, we monitor and observe. We just keep an eye on how often they're happening. Step 2, and this is the big one, we work on managing all those triggers we just talked about. And then step 3, and only if the PACs are really frequent and bothering you a lot, do we start to consider medications.
All right, let's dive into managing those triggers, because this is where you have the most power. We're talking about things that can be as simple as, say, cutting back from 3 cups of coffee to 1. We're finding healthy ways to manage your stress, maybe through walking or meditation. Limiting alcohol is a big one, and of course, stopping smoking. Even making sure you're eating a balanced diet with enough potassium and magnesium, that can make a huge difference. Now, what about for people who do have really frequent or super bothersome PACs? Well, in those cases, medications can be incredibly helpful. Things like beta blockers or calcium channel blockers can help calm down that irritable spot in the atria and just make the heart less likely to fire off those early beats. But again, I want to stress, this is usually a step we take after we've really tried to address all those lifestyle triggers.
All right, quick pop quiz for any students watching right now. Based on everything we've talked about, what is the first most important step in managing infrequent PACs for most patients? If you said managing modifiable triggers, you are 100% correct. That is always where we start.
Look, at the end of the day, that fluttering feeling, that skipped beat, it can be really scary. I get it. But hopefully, as we've seen today, just understanding what it is, just an eager musician playing a note a little too soon, and knowing that you have the power to help manage the triggers, that is the single most powerful step you can take toward feeling better and feeling less anxious. In this case, knowledge really truly is the best medicine.